The heart is a pump that pumps the blood around the body in two separate circulations. The blood returning from the body is pumped out by the right heart to the lungs. Returning from the lungs, it comes back into the left heart and it goes out to the body. And that's through the left heart, and that's the muscular chamber of the heart and the most important. Valve problems really occur on the left side. It's the mitral valve is the inflow valve to the ventricle. The aortic valve is the outflow valve that pumps blood out to the body. The valves are in place to, like in any other hydraulic circuit, to allow blood to flow when they open and to prevent backwash of blood when they're supposed to close. And these two valves can become either insufficient, which means it leaks backwards when it should be closed, or stenotic, or too tight, meaning it does not open well enough when it should be open. Symptoms of valve disease can be, they're not really specific for either aortic or mitral. Generalized weakness, shortness of air, tired, lack of energy, things like that. Difficulty breathing when sleeping, laying flat, or periods of time when you wake up short of breath in episodes and then settles down. These are all signs of congestive symptoms of congestive heart failure that the valve dysfunction can create. Chest pain and syncope or passing out are symptoms that the aortic valve can bring on. The treatments, you can, basically medical management is good until symptoms become intolerable or the heart may start to change on the echocardiogram. And even in patients without symptoms, you can start to see some changes in the way the heart beats and its strength with valves not working right. The heart will compensate quite a bit for a long time, particularly in aortic insufficiency or mitral insufficiency. When symptoms develop, people will go to their regular doctor. It'd probably be referred to a cardiologist to assess the symptoms of shortness of air, change in exercise tolerance, chest pains. And the primary diagnostic mode here for these valve problems is an echocardiogram. And it's a non-invasive test. It's done in a few minutes' time and can be read and get a good picture of the valves, their structure, their function, and pressure measurements, how much is leaking or regurgitating. A lot of information can be gotten from that. Well, again, it depends on how symptomatic they are to start with. If it's a repair done because of a finding on echo in an asymptomatic patient, they're going to be able to maintain their quality of life and their vigorous activities, but they're going to have to get over the operation first to do it. In people who, particularly mitral insufficiency and aortic insufficiency symptoms, can be tolerated for a long time and not really recognized. They can be very insidious and be decades long. And people say, no, I'm not very short of breath, but they have really slowly reduced their ceiling of activity to the point of not bumping into those symptoms. And post-operatively, they're a bit surprised as to how much more they're able to do, so they really do improve quite a bit. So I think, yes, I think you can expect, following the post-operative recovery, rather dramatic improvement in patients that are symptomatic, even if they're not as aware of it because it took so long to develop them. But the quality of life is really markedly improved in a symptomatic patient. Well, I've been at Shawnee Mission for 2 years, and I've worked with a number of these cardiologists for over 20 years, and in different settings. I think what I find the most rewarding is the comfort level of having intellectual and academic discussions about what's going to be best for the patient. So I think a lot of that, the thing I'm most proud of is our working relationship, and I think the quality of work that produces. I'm Clark Henry Jr. I'm a cardiovascular surgeon at Shawnee Mission Medical Center.